Many women at high risk of developing breast cancer are missing out on life-saving drugs. Researchers say the women most likely to get the disease are not being offered the medication they need. Here's medical reporter Sophie Scott.
There are some practical steps women at risk of breast cancer can take, like maintaining a healthy weight and limiting alcohol intake. And there are medications that can make a difference.
It's pertinent that all women should have their personal risk of breast cancer assessed by their doctor, and then if they are at increased risk, a discussion about whether it's appropriate for them to use these medications.
But a study in the Medical Journal of Australia has found that less than 3% of those women who are eligible for the drugs are taking them. Doctors say the medications like tamoxifen can reduce the risk of breast cancer by as much as 40%.
For women who are at very high risk, there are other surgical options as well that should also be discussed. So there's really a range of risk management options that really need to be discussed with women.
The reasons why women aren't getting the drugs are unclear. Researchers suspect that doctors may be reluctant to prescribe them because they're not on the pharmaceutical benefits scheme. The drugs do have some side effects which are relatively rare.
I think for those women who are assessed to be at increased risk for breast cancer, it's important that they are offered the information and the assessment to discuss the potential benefits and the risks in their individual case.
The latest guidelines on cancer prevention recommend that women with moderate or high risk of breast cancer be offered the drugs. Sophie Scott, ABC News.